Hello, my name is Mark Brown, and I have been live tweeting from the Quality Improvement Conference for the past 3 days. I did a video summarising my impressions on the first day and the second day. I've been asked to do a final video, kind of sharing some of my thoughts about what the things I've heard have been over the last 3 days. I think the strongest thing that I took away from the third day is that kindness is a means by which we might begin to bring about equity in healthcare. Equity and inequality aren't the same thing. Kind of in line with the things that I was saying in my previous two videos, what is increasingly clear is that while our healthcare systems might be large, while our systems of care might be large, to deliver the important things to the people to whom our healthcare systems are important requires not getting better at doing the same thing for everyone, but getting better at making sure that everyone, regardless of their difference, regardless of their background, gets exactly what they need from the things that we provide and the things that we deliver. Today I heard about, the terrible inequalities of the effect of the COVID-19 pandemic, and heard about lots of ways in which kindness isn't just a fluffy add-on to the mechanical delivery of health and care. Kindness is both an action and a foundational value. The idea that we might learn how to treat our colleagues with kindness, the idea that we might learn how to treat the people that we care for with kindness, moving from empathy as the emotion of looking on at someone else's situation to kindness being the actual action of doing something to solve the problems or the challenges that they're facing. This discussion about kindness felt both very, very obvious, but also kind of quite new to healthcare. The assumption that providing healthcare is a kindness in itself is not kindness enough. Concern, understanding, being able to put yourself in someone else's shoes, to recognize the ways in which disrespect, discrimination, unconscious bias were all forms of unkindness, felt very, very important. In the session on kindness that I attended this afternoon, someone made the comment that unkindness starts at the top. Unkind leadership in health and social care, leadership without regard, without respect, without empathy, cascades down organisations. So kindness ultimately is core. Linking that to the things that I've heard a lot over the last 3 days, the strongest thing for me was the idea of closing the loop between planning and strategizing and abstract ideas, and then implementing them as actions on the ground, and then knowing what effect those actions on the ground had. So there's an interesting question about what your metrics for kindness would be and what you were measuring in terms of kindness. Not just satisfaction, but actually change in the world. Does our world become a fairer and safer place by the actions we take in health and social care? I think the final point that I took away that sits with me very, very strongly is the idea of psychological safety, the safety to be yourself, to be present in the things that you do, and also the safety to be uncertain, the safety to not know things, the safety to be able to ask, to call on others for support, and also the safety to make mistakes. So I think in terms of quality improvement, the things that I've learned are we need to make sure that what we do works for everyone it's intended for, rather than trying to get everyone to work for the things that we're doing. So shaping local things, local knowledge, all of those things. But kind of beyond that, kind of right at the end, the whole methodology of quality improvement, for me and what I've heard, is not situated in the practice of quality improvement. It's situated in the action of quality improvement, and that is something that sits in teams and it sits in relationships between people. It's not just something that you draw up in abstract away from everyone. I think that's probably the end of my observations. It was a lot to take in over 3 days. I took a lot that was heartening away from it, and I also was very glad that across the sessions that I was in, people didn't turn away from difficult questions. Discrimination exists, racialization exists, bias exists, poor care exists. We can't just be happy and fluffy and clap and say, aren't we doing a great job? We need to look at who what we do doesn't work for, and we need to make sure that it begins to work for those people. Because kindness is sitting with the horror of other people's lives and then doing something about it. Healthcare systems have to work for everyone. If we're letting people down, then there's no hope for population health and wider change. Okay, thank you. Had a great time, and hopefully see you again next year.